Good evening. Welcome to Team 2's presentation on Amour Healthcare Services. I'm Laura Warren and I'm here with the rest of my team members who are going to introduce themselves.
Hi, I'm Joanna Kulik-Daimek.
Hi, I'm Beata Martinez.
Hello, I'm Laura Wilkie.
Hi, I'm Lizette Thaler.
So we'll start with the overview of the business plan report. It begins with an introduction of Amour Healthcare Service and the type of business and industry as a whole that they will be operating in. It goes over the client's current business environment, your external and internal conditions, the vision and mission statement of Amour Healthcare Services, value chain analysis, a SWOT analysis, and the 5 forces model. Also discusses the client's business environment potential, proposed vision and mission statement, and the implementation plan for 3 years. Overview of the business. Amour Healthcare Services is a home healthcare startup company. It will provide skilled home healthcare services to infants, children, adolescents, and young adults from birth to 18 years of age who have been diagnosed with congenital problems, chronic illnesses, are on ventilators, or rely on other types of technology. These patients have a doctor recommendation for home health care. This is a corporation based in San Antonio, Texas, a small corporation with less than 500 employees. The owners are Lizette Talia and Andre Talia. They will serve patients covered under Medicare and eventually want to expand to geriatric care as well. So the external data that was collected for the business plan includes the macro environment factors and the micro environment factors. So for macro, that is the economic, social, cultural, and demographic factors, political, government, and legal factors, and technological. So economic, of course, is impacted by turnover, job growth, household income level, and social status. The second one is impacted by aging population, increasing life expectancy, ethnic majority, and population growth. Political, government, and legal impacts this business significantly due to the rate of inflation and the level of Medicare and Medicaid reimbursements and the Affordable Care Act that was signed in 2010. Technological is the internet, just like any other business, along with e-commerce and the health information technology system. For microenvironment factors, you have competitors, customers, and suppliers. So competitors, there's 169 Medicare certified home health agencies in San Antonio. Customers really are just infants, children, and adolescents, and young adults birth to 18 years. So this population in San Antonio is about 4,400 people at the census in 2010. Suppliers are your physicians, your case managers, your discharge planners, your nurses, and family members. For internal data that was collected, the business is going to be run based on the 6 functions of strategic management, those being management, marketing, production and operations, finance and accounting, research and development, and your management information systems. So for management, there's planning, organizing, motivating, staffing, and controlling, and this will all be done by the owners of the business. They have a plan of a budget for the first 2 months, organizing, and developing a job profile for each position, motivating the employees, and develop a means to communicate with the staff, hire and invest in the best people and control. So you want to be able to compare your results favorably to your planned results. Marketing, product promotion, place, and pricing. The P's, so they will be looking at the product, which is a service, promotion, how are we going to market this. The place is going to be in San Antonio, and pricing is dictated by Medicare and the government. Production and operations, so offer services 24/7 year-round in clients' houses. Finance and accounting, there's no historical financial data to go off of, so the owners have saved $50,000 for the startup of the business. Research and development is minimal. There's not much for this business yet, but there will be more to come in the future. And management information systems, industry-specific software, electronic medical records, and a website that will be used to communicate to customers. The vision and mission statement currently, the vision embodies all 3 elements that are presented in the text, so it does not need to change. It ensures unanimity of purpose within an organization, provides basis for allocating resources, establishes the organizational climate serves as focal point for individuals to identify with the organization's purpose and direction. It also facilitates translation of objectives into a work structure, specifies organizational purpose, and translate the purpose into objectives. The mission statement for Amour Healthcare Services is to provide optimal quality and patient-centered health services to patients in the comfort of their homes. AHCS will provide compassionate nursing care services to pediatric patients in the San Antonio area with close collaboration from an interprofessional team of healthcare providers. As far as the value chain, there are 3 activities present in Amour Healthcare Services value chain. It begins with the providers. The providers are the actual business and the nurses that provide care for the patients. This can also include hospitals, physicians, nursing homes, other type of providers in the same business. Insurers are your medical insurance and other agencies that will cover the cost of the patient's care. And the payers, of course, is the government through Medicare and Medicaid. And sometimes it can be employers of large accounts and small groups or individuals who are paying out of pocket. The value chain for home health care is relatively simple in comparison to the value chain that you may be most familiar with. So Porter's 5 forces is a structure that makes an effort to study the concentration of competition within an industry and business strategy development, used to determine how an industry may be adversely affected by the 5 external forces. So all businesses are impacted by this, some more than others. So bargaining power of suppliers, rivalry competition, substitute services, bargaining power of consumers, and potential entry of new competitors. Really the 3 main external forces impacting the business are competition, substitute services, and potential entry of new competitors. It's relatively easy to enter this business. You just have to have an initial startup and funds for that. There's many substitute services out there between nursing homes, hospitals, assisted living, and other private practices, and then there's a lot of competition with which are your substitute services as well. They're all competitors as well as other home health care agencies. For a SWOT analysis internally of the business, the strengths are talented labor, it's a niche market, there's product differentiation, a holistic approach, and flexibility and long operational hours. The weaknesses are a lack of a marketing plan, lack of brand or identity image. There's really no reputation out there yet, and there's limited initial staffing and small startup budget. Opportunities are growing market, affordability, and comfort. It's a very expandable business model, and there's a lot of availability and new technology and collaboration. The threats posed to the business are competition, very low barriers for entry, reimbursement and regulations by the government, professional staff, business cash flow and funding, and rapidly changing technology. So the proposed mission statement is Amour Healthcare has a real concern for local pediatric patients' health and care. Therefore, it will offer optimal quality and patient-centered health services to patients in the comfort of their homes through its highly motivated staff and through the use of excellent computer hardware, tablets, and software. AHCS will recruit, motivate, reward, and retain the staff through the opportunity of growth and expansion. The staff will provide compassionate nursing care services to pediatric patients in the San Antonio area with close collaboration from an interprofessional team of healthcare providers. AHCS will conduct operations conscientiously and, as a result, achieve constant growth for a desired successful outcome through outperforming competition by providing wonderful nursing care services and by placing pediatric patients' health above its profits. This will be the mission statement that will be used as the business goes into effect and goes live in 2016. So long-term objectives and short-term objectives, and really the generic and business level strategy for Amour Healthcare is the short-term will be discussed during the implementation plan below. The long-term objective is really agree with what the owner's looking to do, and that's expand the business to Austin and Corpus Christi after 3 years, and expand the business to include geriatric and adult care. For generic and business level strategy, differentiation is really what sets this business apart because it focuses on pediatric patients, young children, and the strategy that we see fit is the best value focus strategy, and this offers a niche group of customers, products, or services that meet their tastes and requirements better than their rivals. Amour will also use market penetration and market development to strategize and grow their business. Recommended strategies for Amour is offer quality and cost-effective, patient-centered nursing care, hire a qualified nurse with a minimum of 1 year experience, and nurse develops a care plan based upon needs of patient. So there's that 1-to-1 ratio. Invest in marketing through advertising. Print flyers that will be distributed to hospitals, doctors, and other nursing homes around the area. Ads in local newspapers and magazines. Design a website and create social media outlets. So create an organizational culture that supports the organization's mission, vision, values, and the unique quality of care strategy. Those values are, benevolence, integrity, dignity, trust, respect, collaboration, innovation are exemplified by all of the staff. The staff must be fully on board with this in order for Amour to be a very successful company. The implementation plan over 3 years. All 3 years are very similar. Management and HR, we're going to begin with hiring 1 full-time office administrative staff, employee orientation, and develop policies and procedures using evidence-based practice guidelines. No cost is done by owners. Marketing, so print flyers and distribute in hospitals, doctors' offices, and grocery stores. Print advertisement in local newspapers, magazines, and church bulletins, and organize an open house and invite nurses. Run promotions on social media platforms. Operations, so ensure there's an administrative staff to cover business hours. Ensure nursing staff covers all the hours allocated to the patients. And the owner will be on call after hours to cover the nursing staff in patient's home. Finance and accounting, maximize profits and reduce costs. And for management information systems, design website and create social media accounts with Facebook and Twitter. And research and development, implement research findings into the practice to improve care. Sources of revenue for year 1. This is based on a 60 days, so a 2-month structure. So 228 hours per week equates to $54,720. So you multiply that by 6, you get your year 1 revenue. And this is based on 3 patients. For year 2, management and HR, we're going to hire 8 more nurses as needed to cover for new patients, and continuous education for nurses and update nursing license. Marketing stays the same. Operations, you want to retain the nursing administrative staff to cover the business hours and patients. And for IT and MIS, install software for electronic documentation and purchase tablets for the nurses. Update and modify website and social media platforms. So year 2, sources of revenue. This is based on 6 patients, 560 hours per week for 60 days, 2 months, $134,400 every 2 months. Year 3. 8 more nurses will be hired to cover for new patients and continue educating the nurses and updating their license. Marketing stays the same. Operations, you want to retain the nursing administrative staff to cover the business. Admit new patients. That's what drives your profit. Maximize those profits, reduce the cost. Continue to update and modify electronic documentation software program. Modify the website for any new news that may have come about. Year 3. Based on 10 patients for $211,000, $200 per 60 days. So that's on 880 hours per week of care. So for the financial ratio analysis of key indicators, as you can see on the slide above you, the liquidity ratios continue to grow and are better than the average. You look at our profit margin, it's going in the right direction, better than the industry average, as well as your return on equity and your operating profit margin. The income statement, profit margin continues to grow after year 3 at 27.35%. Your revenue grows exponentially year over year, and your net income almost doubles every year. Balance sheet showing your liabilities, which is solely tied up in labor. As you can see, that continues to grow as more nurses are hired, more patients are acquired, and more care is given. Cash flow, net income grows as stated previously, and the cash and securities at the end of the year have grown exponentially, ending in year 3 with $428,696. So in conclusion, the company must offer outstanding holistic services. Nurses and owners must listen and collaborate with each patient, continue to utilize strategic management to operate the business, develop a supply chain that is efficient and effective to assist with service. The niche market will give Amour healthcare services an advantage over competitors, and the future is bright. Average lifespans elongated, growing populations. There's a need for healthcare in the world today, and patients want to be in the comfort of their own home when receiving care. This concludes our presentation. Any questions?